the second episode of Drug Talk. I'm your host, Garrett Campbell. So I'm just fresh off a shift here today. It's about 5 p.m. But because I just love drugs so much, I figured I'd make a second episode for you. In the last episode, episode 1, we talked about ibuprofen. At one point during my talk, I actually mentioned another medication called Pantoprazole. One of my good friends asked me if I could make that video for the second topic, so here we are. Before we actually get into the medication, Pantoprazole, just remember, as I always say, this channel is for information purposes only. If you have any questions about what I talk about here, or about your medication or your healthcare in general, always direct them towards your personal healthcare provider, be it your pharmacist, your doctor, or whoever else you do see. As you may have guessed, if you watched the first episode, I like to talk about the history of the medication before we actually talk about using it. So, Bike Golden, a subsidiary company of Altena, started their drug discovery department in 1980. From that department, in 1985, is when they actually produced Pantoprazole. Now, the year before this, in 1984, Altena actually partnered up with Smith, Kline, and French. Now, because of this, when they were making the compound, it was actually given 2 discovery names. One was BY1029, and the other was SKNF 96022. In 1986, they finally created the Pantoloc sodium salt and were ready to start manufacturing the medication. It did take a little while to actually hit the market, and first hit the market in 1994 in Germany. Now, a company called Wyeth in the United States actually bought the patent for US marketing from Altena and began marketing it in the US in the year 2000 under the brand name Protonix. Now, in 2007, Altena was actually acquired by Nycomed. 4 years later, in 2011, Nycomed was acquired by Takeda. And remember that company I mentioned, Wyeth, who got the patent for US marketing? They were actually acquired by Pfizer. The reason I tell you this is because the story actually gets a little bit interesting. See, their patent was actually set to expire in 2010, but a generic company known as Teva decided that they would produce their own version of Pantoprazole in 2007. To achieve this, Teva would have had to have filed for an ANDA, or an abbreviated new drug application. Now, Nycomed and Wyeth actually sued Teva, but Teva decided to go ahead with their medication anyway. After all the court proceedings had finished, by 2013, this move actually cost Teva $2.15 billion with a B dollars. All right, enough about the history. Let's talk about drugs. Now, Pantoloc is what's known as a proton pump inhibitor. It works by suppressing the gastric acid through the hydrogen potassium ATP pump, which is located in the parietal cells of your stomach. If you were prescribed Pantoprazole, you may actually get it under several different names. I mentioned in the States the brand name Protonix. In Canada, it comes as other names such as Panto IV for the IV form, Tecta, which would be a tablet, as well as Pantoloc. These days, Pantoprazole is available as 2 salts, magnesium and sodium. We're not going to discuss the reasons behind using either or in this episode, but that is something that will be decided by your physician. So why would somebody be prescribed Pantoprazole? Why would somebody benefit from having less acid in their stomach? A common reason people use this medication is for what's known as GERD, or gastroesophageal reflux disease. It can be also used to treat other conditions where the symptoms just result from having increased amounts of acid in your stomach. If you are using this medication, it's important that whenever you meet with any healthcare professional, whether that be your physician, your pharmacist, your dentist, or even in this case, lab workers, not that you would be meeting with them yourself, just let them know that you're using this medication. An individual will be instructed to use extra care if they are at risk of having brittle bones associated with osteoporosis. Some of these risk factors would be consumption of alcohol, smoking, certain medications, as an example, some medications that people use to treat epilepsy, and having a family member who suffers from osteoporosis. Another consideration would be the individual's age, as this medication, similar to the medication we talked about in the first episode, ibuprofen, falls on the Beers criteria. Now, they fall on the Beers criteria for different reasons, so Lucky you, I'm going to read the Beers criteria on Pantoloc. Proton pump inhibitors are identified in the Beers criteria as potentially inappropriate medications to be avoided, as scheduled use for more than 8 weeks. In patients 65 years and older due to the risk of C. difficile infection and bone loss/fracture. Use for more than 8 weeks should be avoided unless given for high-risk patients. As an example, oral corticosteroid or chronic NSAID use, patients with erosive esophagitis, Barrett's esophagitis, a pathological hypersecretory condition, or if the patient has demonstrated a need for maintenance therapy. As an example, failure of a drug discontinuation trial, or failure of H2 blockers, such as ranitidine. This specific medication does not have any black box warnings. So I quickly mentioned earlier that usually pantoprazole is used for GERD. Now there are some other things that it can be used for as well. Different pathological hypersecretory conditions, such as Zollinger-Ellison syndrome, can actually be treated with pantoprazole. Here in Canada, we use 40 milligrams of pantoprazole taken once a day to treat peptic ulcer disease. If you had a duodenal ulcer, you'd probably use it for about 14 days. If the ulcer was in your stomach, which would be known as a gastric ulcer, we're looking at 28 days. Now, of course, your physician may choose to extend this therapy for another 2 to 4 weeks based on how your symptoms are resolving. And some people end up using it ongoing. Another interesting use for pantoprazole is when somebody is infected with a bacteria known as H. pylori. This bacteria is treated with combination therapy. You can use 3 or 4 medications, typically consisting of a PPI alongside with some antibiotics. An off-label use would be the prevention of rebleeding with a peptic ulcer bleed. The last thing to mention before we get into the drug in terms of while you are taking it are your kidney and liver function. In Canada, if you have renal impairment, you no longer use a PPI when you're treating H. pylori. In terms of your liver, if you have mild to moderate impairment, there's no need to adjust the dose. If your liver is severely impaired, the maximum dose would be 20 milligrams a day. Now again, similar to your kidneys, in Canada, with this severe impairment, you would no longer use a PPI to treat H. pylori. Alright, so you're ready to take Pantoloc. Typically, Pantoloc is taken once a day, although it can be taken more frequently. It's available as a 20 and 40 milligram tablet, so usually people take 20 or 40 milligrams each day. Although many references say it can be taken without regard to food, typically it seems to be taken about 30 minutes prior to your first meal of the day. When you take the tablet, it's important not to crush or chew it. That's because a lot of the times these tablets are covered with what's called an enteric coating. This coating is on the tablet so the tablet can survive the acidic environment of your stomach and make it to your intestine. There, it will dissolve and be absorbed, usually through your small intestine. If, while you're taking pantoprazole, you forget a dose, don't panic. You can just take it as soon as you remember, unless you're close to your next dose. Never double up on the dose because you missed your previous one. Just take one single tablet. Although the side effects are typically minimal from pantoprazole, some that you may notice while you're using it are headache or loose stools. Sometimes you may get a little bit gassy, or you may notice some joint pain. The two main side effects, which occur at about a 9 to 11% rate, are headache and diarrhea. In terms of a little more serious effects of the medication, remember we mentioned in the Beers criteria the increased risk of C. difficile, as well the increased risk of potential fractures. Aside from these side effects, some people experience low levels of magnesium. This can happen if you've been using a PPI for 3 or more months. Most cases seem to happen if you've been using it for greater than a year. Luckily, magnesium levels seem to go back to normal after about 2 weeks post-stopping therapy. If you're using the medication for greater than 2 years, some people experience vitamin B12 malabsorption, leading to a deficiency in this vitamin. As with all medications, there's a chance that you could be allergic to pantoprazole. Typically, allergies to medications present as difficulty breathing or hives or some other symptoms. If you were to experience this, you'd want to seek medical attention as soon as possible. Alternatively, you may also want to seek medical attention if you experience chest pain, stomach pain, any pain that is concerning you, and if you were to notice blood in your vomit or in your stool. Typically, you can tell this by your vomit would look like ground coffee and your stool would have a black tarry look to it. If you're using the medication for a couple weeks and you notice your symptoms go away, don't necessarily stop taking the medication. That's something that you'd want to talk about with your physician or your pharmacist. If, after talking to your healthcare provider, you decide to stop taking the medication, be aware that some individuals experience what's known as rebound acid secretion. So, say for example, you're taking 40 milligrams of pantoprazole once a day. Then, after realizing that your symptoms have improved, you stop taking the medication. And your symptoms come back, potentially even worse than they ever were. A lot of people would think, well, I guess I need this medication long term. But it could just be the fact that your stomach is responding to the lack of the medication and producing more acid. This may be short-lived, or you may be able to treat it with, say, 20 milligrams of Pantoloc. There are plenty of different ways that you can discuss with your physician or pharmacist of how to come off of this medication. Just sit down and have that conversation. As the medication makes its way through your body and heads towards the exit, it's excreted 70% in your urine. The main enzyme that breaks down pantoprazole is 2C19, with some action by 2D6 and 3A4 as well. That's really all I have to say about pantoprazole. I will remind you, as you may have guessed, never use this channel to make your personal healthcare decisions. Always consult your physician or other healthcare professional. This channel is for information purposes only. I'd like to thank everybody for the great response I received for the first video. My goal, admittedly, was to receive about 100 views between the time where I released the first video and created this, the second video. Luckily, I just checked and I actually received 300 views with some likes and comments and subscribers, which is really exciting for me. If this is your second time stopping by, I'll assume you enjoyed the first video. If it's your first time stopping by, I just want to say thanks. I really appreciate it. If you'd like to see when my videos are released in the future, just hit that subscribe button so you can get a notification. If you'd like to help support the channel, you can hit the like button. Also, you can follow me on Instagram and Twitter. Alright, so that's all I have to say. See you later, and subscribe below. And here's where you can find me if you'd like to follow me. On Twitter, you can find me at Talk About Drugs. On Instagram, it's GSauce24, and on Facebook, just my name, Garrett Campbell.